All right, this is number 3, and this is just a few little items that I couldn't get to, and the thing cuts off after 15 minutes, so there you go. Um, I think I finished on just re-emphasizing that you make sure you understand exactly what are the typical actions that you take to really do bowel and bladder programs for patients that have lower motor neuron injuries. Also, it's very common for with spinal cord injury patients for them to have reddened skin. And as with anybody who has a very low Braden scale score, there's going to be pressure reduction surfaces, there's going to be turning and positioning, there's going to be teaching the paraplegic to modify their own weight distribution frequently, and lots of things that are covered related to that, because preventing skin injury is very key. As you can imagine, people will get severe breakdown, as we've discussed in class, some of which can be stage 4 very deep wounds that may never heal and just become a chronic wound bed to manage. And the patient, of course, is not affected from the standpoint so much of pain related to it because of loss of sensation. However, the extreme risk is, of course, severe infection and sepsis. Symptoms of neurogenic shock, make sure that you look up like the typical things when patients would go into neurogenic shock. What would they exhibit, particularly related to heart rate, blood pressure, urine output, level consciousness, and oxygen saturation, so that if you had a patient that was beginning to have some of those symptoms, you would be able to pick that up readily. Standard nursing interventions on a care plan for a patient with the halo fixator. That's really shown in your book really well with a picture of the fixator, and goes into the typical things that you really want to do with that. Sometimes those pins can become dislodged, so really looking at those to make sure that everything is intact. Again, doing psych care like we talked about in class is very important. And then one thing that we didn't mention in class, and I'm pretty sure is covered in your book, is that apparatus covers part of the chest and clavicle area. And so if you should have a patient that's in a halo that you have to do CPR on, or it's whatever you've got to do to try to provide resuscitative care, it is standard to have a halo wrench the size of those bolts, so that if for any reason in a cardiopulmonary arrest situation that has got to be removed quickly to be able to access or do something to the patient, that is there. So a lot of times they will have that attached to the patient's vest, or readily accessible in the patient's room. And then there's other typical things that you want to look for, like to try to cut down on any kind of skin breakdown around the areas where it fits, and is closely rubbing the skin. Home management requirements for bacterial conjunctivitis. Obviously there's a lot of things in your book that talks about like how do you maintain a clean environment, and we talked about that in class, because even nurses can get this pretty readily. How do you really ensure that you're not cross-contaminating the next patient, the next employee? And the same thing is true in the home environment, that not everybody in the household is catching this, because it's very contagious if some of those particular things are not done. And then post-operative discharge instructions for cataract surgery. Those are covered in your book very well also, but mostly in the sense of anything that decreases pressure or leaning forward or extreme exertion, because you do not want a lot of pressure forced forward on the eye itself. But review those to make sure you're clear. With these medications, and I apologize, my dog is barking in the background. Make sure that you look up each one of these drugs and know its indications, know things that you would teach the patient specifically about taking this, and how these drugs would be used for the diseases that we have covered for this particular class or section of the course. Good luck, everybody.